Welcome to the Longevity Protocol with Dr. Cristina Bosch and Dr. John A. Robinson. We'll be your guides to uncovering the secrets to optimal health, better sex, and happiness. From debunking aging myths to exploring the science behind what it means to live the Longevity Protocol, we'll dive into a wide range of topics. So, get ready for an exhilarating journey in what it means to live well and feel your very best at any age. Let's optimize fertility for men and women.
Woohoo.
Let's talk about that. We've had some of our own ups and downs with all of that personally, haven't we?
Okay. That would be a way to say it.
So we're obviously blessed with 3 beautiful, dynamic, feral daughters. That
I've birthed. Obviously, we have a 4th.
Yes. She is also incredibly dynamic as well. 4th.
Not as feral, thank God.
Not as feral. She's far demure, I guess, in that case. But we've had some issues along the way. I mean, it didn't just happen right away.
No,
but we've also, and issues, not just issues, but we have our own strategies and things that we're going to talk about today that we were able to do ourselves. It was part of our success, but even in the midst of that success, we had some difficulty.
I mean, I think it's important for the audience to know, because not everybody knows, that we got married when I was 34. We were pregnant 3 months later. So I gave birth to our daughters at 35 years of age, 37, and then the last one at 42. So that's definitely considered advanced maternal age, although I have comments about that as well.
I'm sorry, you just said
what?
That we got married and then 3 months later, 3 months later we were pregnant.
Yeah.
Oh, my brain just thought you meant that 3 months later we gave birth.
You don't remember that?
Well, I just wanted, my brain's thought birth instead of pregnancy. And then I thought, well, the audience is going to think that was a shotgun wedding.
No, plus I had no stomach in my beautiful wedding dress.
Well, you couldn't fit anything else in that wedding dress.
Barely.
It's amazing.
I look good.
It was amazing. Yeah. Beautiful. I have such memories of that. Wonderful man. Anyway, yes, 3 months later, you were pregnant. Yes.
Yeah. So, I mean, I just want to start with that caveat that, yes, getting pregnant later in life is totally doable. There's lots of techniques which we will cover that help that. And that if that's where your path takes you, then that's where your path takes you. But if you're one of these women that's purposefully waiting, then I don't think that that's the best strategy. I think women think that the minute they decide they're going to get pregnant, they're pregnant. And that's just not usually how it goes. I feel like it's one of the greatest lies ever told was focus on your career. You have plenty of time. And it's just not true. I've worked with lots of women that really had struggled.
Yeah.
And myself, I mean, I'm super happy that I had my baby at 42, but we were like at the 11th hour before I said, enough is enough.
It was 11:59. It was we rode the bus until the wheels fell off, for sure. Came skidding into home with little Eliana. We did it though.
Oh my God. And these things that we're talking about were the reason.
Well, and some people understand that context, what we just said about the last one and Eliana. So between our second and then Eliana, there was how many miscarriages?
3 miscarriages.
3 in between.
So I've had 3 perfect pregnancies and live births, and I've had 4 miscarriages. So, I mean, it's, I know a lot of people have a different experience with that. I think for us, we were able to think very intellectually about this. We were able to say, if this baby is not well, it's not meant to be from my perspective. At least that's what my faith dictates. And that I was able I would say in the grand scheme of things, pretty easily to make peace with that. It was difficult, of course, and it's physically exhausting. And there's definitely some PTSD that comes with that. But
we kept going.
All's well that ends well.
We just kept going, and we employed more of the methods that we understand and
And we focused on you as well,
Yes,
which
that
is
was
part of what we're going to talk about, that
yes.
fertility is 1+1. It's not all
Correct.
female.
Yeah. And that actually we're understanding more now through research that sometimes, many times when women are having miscarriages, it was because there was something wrong with the DNA
Yeah.
of the sperm that impregnate. I mean, it's again 1+1.
Yeah.
It takes 2 to tango. So, okay. That's what we're talking about today. How do we optimize fertility in men and women? Why are we dealing with fertility issues in general across the board in both men and women? We had an episode where we talked about testosterone and that decline generationally we've seen in men, and
Well,
inevitably that
and
means
we gave a
sperm.
lot of reasons, and I've said that I believe that there is a chemical castration happening.
For both men now and women.
I say that very black and white. Obviously, that's not a black and white thought nor feeling. So just for the purposes of drama, it's chemical castration, the amount of chemical toxicities that we have in the environment that are interfering with humans' ability to successfully procreate healthy babies.
Mm-hmm. Mm-hmm. There's more obstacles than there should be. What type of diet should you eat? What are the superfoods for fertility? What does our environmental situation play a role? How does the environment play a role in fertility? What you were just talking about. How do we detox from some of those that chemical castration that's
Right.
occurring? And what are some of the best tests for fertility, maybe outside of what people would certainly think about?
Okay, cool.
Let's go through some stats, because I think that's always a fun way to start. I certainly like to dork out on that. 10 to 15% of couples in the United States are infertile, so that you're not alone. So it's roughly 1 in 10. You're not alone, that people are having issues. Infertility affects about 15% of all couples in the world. So it's not just in the US. So it's kind of roughly that same stat. And then approximately 40% of all infertility cases could be contributed entirely to male factors.
Right,
so it's kind of like entirely male, entirely female, and then maybe perhaps a combination of the two.
That's right.
So, it's a huge percentage. And we just historically, and I mean recently historically, you just always point to the woman.
Yeah.
You're just thinking it's all about her.
Yeah, which is one of my comments about some of these stats is that I wonder how skewed they may be low on the male, because that's not researched and recorded as well, because a lot of the infertility cases aren't even looking at that.
They don't even say. I mean,
right.
God, that just happened the other day with a patient who was telling me this, who they did not, they had gone through several things and they did not require the man to be tested,
right,
even after they'd had some issues a couple of times in a row. So, I mean, to us, why would you even wait? Why wouldn't you just do it immediately? Why not? It's not that hard to do, guys. You go make a sample.
Easy, right.
It's pretty freaking simple, and then you get a number.
Yeah.
Why wouldn't you just, and it's not expensive out of pocket. It's maybe a few $100.
Right.
It's not that hard to do. So
don't wait for your doctor to tell you that.
Yeah, because they just have doctors, especially in conventional medicine, they have these algorithms that they feel they have to follow. And then the algorithms are also dictated by the insurance company, saying there has to be all these series of things that must occur before we will cover a given test or a given treatment.
Yeah, but it's not just that. It is that, but it's not just that. Because even alternative practitioners that have focused on fertility, they so often don't look at the male until later, because when you're training and your tools are all female oriented, you start to just default to only look like, if you have a hammer, everything is a nail. So sometimes it doesn't even think, the person doesn't even think, let me check outside of what I'm trained to look at first.
Yeah. But why they're only trained to just look at the female that much is a little bit strange. But
12.3%.
Number of women 15 to 44 with impaired ability to get pregnant and take a baby to term. About 7.5 million people, or 12.3%. These are significant numbers.
Totally.
About 20% of women in the U.S. now have their first child. To your point, 20% have their first child after the age of 35.
Right.
And this leads to obviously the issues that we've personally experienced.
Mm-hmm.
Irregular abnormal ovulation accounts for approximately 25% of all female infertility problems.
Which is so important because if you're a teenager with irregular menses and you know you one day want to become a mom, you got to work on that now. And you got to work on it now because there's so much of the lifestyle that we'll talk about. That sense of responsibility in adolescence for your health should be implemented at the moment of adolescence. Otherwise, when you come to us and you're 35 and you want to get pregnant, you're having a hard time, and I'm asking you to change the way you eat, it's like mind blowing what I'm asking you to do.
You know, you're describing proactive medicine versus reactive medicine. I mean, the idea of early prevention and early action is just not part of the way we think enough about health in this country. It is wait until it's broken and then we'll take a look.
Right.
Because then I can sort of measure the brokenness and then I will attempt to put it back together, versus measuring things in its subtle brokenness, or not broken, but subtle dysfunction.
Malfunction.
Yeah, or some kind of malfunction. And then we're going to just put you back right on course.
And, we had an episode on the birth control pill, which was a great episode. I hope all of you have had a chance to enjoy it, where we talk about how often adolescents are prescribed birth control in part because of their irregular menses. That right there starts the cascade for infertility problems or fertility issues, because the reason for those irregular menses was never identified. It doesn't go away when that woman becomes 30.
Right. And it didn't go away when they made their periods a little bit easier.
And it didn't go away when they gave them birth control. Exactly.
All right. So let's get into the diet. And again, something we have been talking about for years, something we have personally practiced in our home.
Right. And still do.
Absolutely. The work of Dr. Weston Price has just been profound for me. And, and for now, for us, what we do. We know that this, now I've been using that term ancestral. I think we used it in the first book. And now you're starting to see that there's brands out there that are saying the ancestral. They're kind of getting back to this idea of an ancestral diet. And what does that mean? Largely, it means high fat, moderate protein, getting back to organ meats and these kinds of things that we would have always done naturally and instinctually across cultural, every culture. This is what Weston Price discovered. This is what he revealed as far back as looking at this in the 1920s and revealing it mostly in the 40s and 50s. I mean, a lot of what we understand in nutritional science is because of the work of Weston Price.
Yeah.
So
those are just super interesting reads anyway.
Absolutely. Yes. Nutrition and Physical Degeneration. That's a good book to kind of get an idea about his work. A lot of what he was looking at was teeth and dentition, and how the teeth were related to diet. Right. And that if somebody ate an ancestral, and vice versa. If someone ate an ancestral diet, their teeth and their jaw and everything would develop correctly. If they would then switch to a westernized diet that was devoid of those types of things, then their jaw and everything would change completely. The maxilla, which is the front bone, all of this would change the structure of the face. Yeah. And then they would pass that on from generation to generation. Their kids and everyone would get worse and worse. So, although you can change those facial features, which are directly connected to so many things like health, beauty, etc., until adolescence. I mean, there's an opportunity to change your kid's diet, even though they've always eaten this way and now they're 9. Well, you know what? Then work really hard for the next 4 to 6 years to keep your child's health parameters much, much higher. Yes. And Weston Price and the Weston Price Foundation certainly talks a lot about that. So that's the type of diet. When somebody comes to us and says, we want the best possible diet for fertility, not just fertility, because we're not going to get into talking about then after the baby comes, but fertility, pregnancy, happy, healthy baby. Breastfeeding, all of these things are based on what ancient cultures would have called the sacred fats. The sacred fats. Oh, I'm hungry, John. I swear. Is it hitting you now? I loved my diet when I was pregnant. It was a lot of milk, preferably raw. Butter is absolutely your friend. Eggs, particularly high quality pasture raised eggs with the really dark, rich egg yolk is what we're looking for. So good. You just really can't get enough of it. Fresh liver
I love organ meat.
Yes, I would make that for you. I still
You
make that
still
for
do.
you. Yeah.
Caviars.
Yes.
Mm,
But other organ meats, brain, tongue, marrow, kidney, lungs, stomach lining,
marrow.
intestines, reproductive organs themselves,
Yeah, oh man.
all of these things can be eaten and should be. Fresh seafood, I think that's a big part of it too. Shellfish, I think, is really important. It's always been a mainstay within Weston Price's work. Fish eggs, like you just said. Small fish, sardines, fish liver oil. I mean, beef, lamb. You kind of get the point here. And you notice that it's mostly these fats and organ meats is the mainstay. And then from there, yes, there could be soaked whole grains. What Weston Price discovered was that the diet, if there was grains introduced, they were always sprouted. They were always fermented in some way in order to decrease all of the negative phytonutrients that are the negative ones that are there, lectins and other things that are actually injuring us. It's a plant's way to have a defense mechanism, and you've got to get all of those negative nutrients out. So they wouldn't sit around and just eat salads all day. That was not how they would process it. They would minimally process through the fermentation and sprouting process.
And also a stronger emphasis on fruit.
Yes.
Versus vegetables.
It's more like fruit and vegetable. Yeah, the vegetables should be less than the fruit ultimately. So obviously we're going to avoid all the junk foods, soybean oil and all the soy, sugar, obviously alcohol, cigarettes, drugs. We shouldn't even be saying that. It's such a given. So what would guys focus on? So this is one of my favorites is oysters. We really love raw oysters. So this is just great as an aphrodisiac. We constantly talk about that, but it's because of the zinc that's in it, but it also has aspartic acid in it. All of these things are important for fertility. Pomegranate juice and seeds for guys. Tomato paste. I've done all this, guys. All of it.
He really has. And again,
seeds.
Specifically tomato paste.
Yes, tomato paste. Why? It has lycopene in it, and lycopene is also really good for your prostate. It's just good for the entire genital.
But we're not going to find that in the fresh tomatoes like you do in the tomato paste.
It's literally it's creating its own multivitamin because they're concentrating it down into the paste. So it has this huge concentration of lycopene versus
tomato paste with sardines on top.
You're hungry. Yeah.
I'm hungry.
Yeah. Pumpkin seeds, pumpkin seed oil, all these are really, really excellent. I would highly recommend all of this for any guy, just in general. This is not
pumpkin
just about
seeds with the shell on are awesome.
Yeah.
Like, just chew right through the shell. Again, mastication, so important to actually chew.
If we think that there's any issues with certain patients with food allergies and food reactions, we'll certainly test for that.
Right. And what we're talking about here with food sensitivity testing is we're looking for sensitivities, not necessarily allergies. This isn't that typical reaction where you eat a peanut, you can't breathe kind of a thing. This is more of a delayed reaction. It's an IgG mediated. So IG meaning immune globulins. So it's like the soldiers of the immune system. Right. There are several immune globulins in the body. So I always like to make it like the analogy of the military. You've got the Navy, you've got the Air Force, you've got the Marines and
Space Force.
And you've got Space Force. And your body has similar different branches of immune protection. IgG is a delayed reaction, so it can take up to 72 hours to express itself, making it very difficult for people to know what they're allergic to without actually testing. And it's a blood test.
Yes. And we do this all the time at the office. This is good for all kinds of people, but particularly from a fertility issue. If you've got anything going on with the gut, you might as well do it.
Yeah, because you want to decrease inflammation.
Yeah. Years ago, when somebody had a fertility issue, this would go all the way back into the early 1900s, 1920s, and 30s. If you had fertility issues, one of the most common medications to give to a woman would have been thyroid hormone. That before they had figured out other, all the fancy medications that are done now. They would just realize that a lot of times if there was that much of an issue, they would just give them thyroid hormone.
And that's still true.
And it is still true, right? So this is an easy way to, default to helping yourself by making sure you're addressing that. And many times patients will say, well, they checked my thyroid and it was quote unquote normal. And they're trying to get pregnant and they weren't given the medication. And so you have to go to someone that's going to understand how to use that medication slightly outside, if not completely outside of the box, and give you the medication anyway. Thyroid
Well,
hormone is safe and simple
mhm.
under a doctor's
You've got
direction.
to be familiar, you as a patient become familiar with the concepts of subclinical hypothyroidism so that even if your labs, and again, we've done an episode on this, I think,
Yes.
even if you don't have this over, every doctor will treat you kind of a thing,
Hmm.
you'll be able to communicate more effectively. And also, if they reference our book, The Thyrozone,
Hmm.
it's a user manual, basically. It just helps the patient understand how to self-assess and then how to be their own advocate.
Address insulin resistance. That's probably one of the biggest reasons why we see women, particularly, having ovarian issues. PCOS, polycystic ovarian syndrome, it is just basically and simply insulin resistance. It's not really that complicated.
Right.
It always shocks me why they try to make PCOS so complicated. It's just get them to lose weight, treat that situation, and the PCOS gets better, which in turn helps ovarian function, which in turn helps with ovulation and pregnancy.
Yeah, because PCOS, you don't even need to have PCOS, meaning it's polycystic ovarian syndrome, but you don't actually need to have polycysts. It's a
Right.
catch-all. It's just
Yes.
like, well, you have this and you have that, so I know, let's call you PCOS. Um, the metformin is very important because I have had women coming in for preconception and they aren't having the obvious measures of insulin resistance, but they don't eat.
Hmm.
They don't eat. So you have to get the person to make sure that they're regulating their blood sugar well through diet.
Sure. And then when they do eat, it's not usually the fats and the things that we were talking about earlier on. It's carbohydrate.
Yep.
It's just making it worse when they do
And
finally eat.
drinks.
So metformin, we've been using that one for many, many years, and now for about the past 4 or 5 years, we've been using the GLP-1 agonists like semaglutide, tirzepatide, and that is something that I think people should consider when it comes to correcting any kind of insulin resistance for preconception. It's a profound way.
Yeah.
To do it.
I mean, think about the fact that we're dealing with preconception, but really what you want to do is have a very pleasant, healthy pregnancy because pregnancy actually isn't a disease. You're supposed to go about your like day-to-day life for the most part when you're pregnant and maybe just feel extra special. If you're already overweight, if you're having that visceral fat, if you're having all of those things we've talked about in the GLP-1 episode, then you should correct that anyways before you should try to correct that anyways before you get pregnant. It's going to make the pregnancy experience and the baby's health that much better.
Progesterone's another therapy that can be done and another hormone that can be done and used for women who are trying to get pregnant.
And particularly women who have a history of miscarriages.
Yes. And what's interesting, Dr. Gino Tutera, who was my mentor early on, he, OBGYN, and God, he'd be, well into his 70s by now, almost 80 by now if he were alive. He was some of the early research that was done on progesterone and using progesterone to help with maintaining a pregnancy was done by him.
Cervical integrity.
Yes.
And yeah.
So it's definitely a hormone that can help and something to consider. And again, I know we always talk about our Substack. If you're wanting the details, everyone, our Substack is going to have that with these particular protocols for both men and women. It's all there. So we are going through it, but there's more detail that you'll certainly be interested in. Clomid for guys. We just did an episode where we were talking about, we use Clomid, clomiphene, and N-clomiphene, these medications to be able to help testicular function, not only for testosterone, but inevitably for sperm. So Clomid's been used for both men and women for years and is a great first line of defense in terms of a mild medication to use for fertility.
Right. So with fertility with the men's sperm, there are several components that we're looking at. We want to make sure, obviously, that it's a healthy sperm. We want to make sure that there's enough of the sperm, and we want to make sure that the motility for the sperm is intact.
Yes. The shape, morphology, the motility, the movement, we want to make sure we're looking at that. HCG, another one that's great for guys that is also used for fertility. It's also used in hormone replacement therapy and progesterone. So a lot of times we don't think about progesterone for guys.
Yeah, this was new to me.
But yes, it definitely helps with sperm health.
Mhm.
And it doesn't take much, way smaller amount that what a man would take in comparison to a woman.
Mhm.
It can actually help guys with anxiety and just kind of calming them down in general when you use low doses of progesterone. You have to address the immune system. I mean, if there's issues that way and there's autoimmunity that's present for both men or women, and we tend to see more autoimmunity in general in women, you have to address it. If a woman comes in and she says, yes, I have a history of lupus, I have a history of Hashimoto's, you definitely want to address that. And that will help with the fertility issue. And one of the best tools that we have found is low dose naltrexone,
Right. Yeah.
LDN. Mhm.
LDN is great. And when you're out there doing your research on that, please remember that you must look it up as low dose naltrexone. If you're
Mhm.
just looking up naltrexone, you're going to find the uses of this medication that are not really applicable to the metabolic functions we're talking about. It's a medication that's used very much in the drug rehab world and many other things, which is great. But what we're talking about is administering it at a low dose for the purposes of reducing immune reaction. And it has a particular affinity for the thyroid. So it's awesome for any of the Hashimoto patients that are having a hard time with conception because of their illness.
Yeah, there's definitely groups out there that are using LDN for fertility. I mean, these are fertility
Yeah.
specialists that use LDN.
There's a lot
in
of
general.
good accumulated data
Yeah.
on LDN.
So I will say, and again, you'll need to check with your doctor, but it is safe to use. And it's safe to use throughout pregnancy.
And it's safe to use throughout pregnancy.
Yes.
Exactly.
Again, at these low doses, we're talking about 4.5 milligrams is the general dose, but it's really somewhere between 1 and 10 that was always studied. And most of the time you'll see it right around 4.5.
Right. As a daily dose. Yeah.
As far as nutritional supplements for women, this pregnancy prep.
I mean, I swear by it.
Right.
I've used it so many times successfully on myself and on others. This is Vitanica.
Mhm.
This is a great
Dr. Tori
Tori
Hudson. A
Hudson.
huge shout out to her and the
Yeah.
work that she has done.
I mean, it's a beautiful company. They're perhaps exclusively female oriented supplements, high quality ingredients, potent dosing, and the pregnancy prep is wonderful. So you would use the pregnancy prep as soon as you decide, I want to get pregnant. I often use this in lieu of the multivitamin so that the person isn't taking too many things. Upon confirming pregnancy, however, you do want to stop it and then switch to your prenatal.
Yeah. The great thing about pregnancy prep and many of the things that are in these Vitanica branded supplements is that it's very herbal based. And the nutrition is coming out of the herbs themselves. So a lot of times we think about herbs and maybe just what it's doing from a almost pharmacological standpoint, but it has a nutritional component to it as well that winds up having the benefit.
Yeah, it's like salad in a pill kind of a thing. That's how I like to think of it as well.
And there's many others, chaste tree berry, tribulus, motherwort, dong quai. All of these things are part of what you would see in many of these formulas through Vitanica anyway.
I just want to take a minute to talk about quality here because people pay, when it comes to herbs, you're going to get what you pay for. So if you're shopping up and down the grocery store and you're seeing, oh, alfalfa, oh, maca, I know Robinson talked about that. And it's like, well, this is so much cheaper. I got it at
Walmart,
at Walmart or Costco. You're getting something cheaper because usually the potency is not medicinal. And this is very true because Americans do not have a palate for bitters. So it's very easy for teas and stuff like that to get diluted, but sold as herbal medicine. They're not herbal medicine if they're weak. They're just stained water. So you do really want to make sure you're paying attention to the brand and the doses that you're taking if you truly want to use botanical medicine to help your life.
If I had to pick one nutrient to use. Are you looking at the notes?
Well, also just because.
Right? I mean, don't you think?
Iodine.
If you had to pick the other
Iodine.
one, because I was sitting there debating in my mind before I said that, I thought, is it iodine or is it vitamin D? Because Because vitamin D is so good on so many different things.
I think it's iodine.
If you had to pick, you'd go iodine.
Especially for this topic.
Yes.
And the reason is because even for those moms that have really great iodine levels, really healthy metabolism, etc., they'll get pregnant. Let's say they get pregnant easily. They have a very nice pregnancy. They feel great. The baby comes out. It's delicious. It's an 8.5-pound baby, super healthy. The mom is now super iodine deficient because the fetus is gobbling up the mom's iodine, which is why hypothyroidism postpartum is so common, or at least it's one of the main contributing factors. So you really do want to supplement. This is going to help with conception, with the quality of the pregnancy, with the health of the baby, and with your postpartum experience. And it's directly linked to IQ for the offspring.
Yeah. Yeah, that's you kind of said it all there. So, and we use a particular potent supplement called Biodine. It has milligram amounts of iodine versus micrograms. We tend to see most, let's say, a multivitamin is going to have a microgram amount of iodine in it, and this is okay, but it's not going to give you the same medicinal punch that you'll get out of milligram amounts.
No, Dr. Turner has really provided us with a beautiful product. And we've been using that same product for what, 20 years?
We were using something that's still out there. It's called iodoral. That was what we did earlier.
Also good.
Yes. Well, the reason that I would say, if I had to say it's not as good as the Biodine that we use, is because it didn't have selenium. In it. And you need the selenium there to balance these really potent effects of what the milligram amounts of iodine is doing.
For sure.
Because you can actually create a selenium deficiency with higher doses of iodine by itself. So you want to make sure that that's there. So maybe many patients would take it, selenium separate. That's how I had to used to do it. Right. But they wouldn't take the selenium. They would only take the iodoral. So here we don't have to worry. Yeah. We know it's there. And if we increase the dose, there's going to be a dose titration up of the selenium as well. So as long as it has some magnesium in it, Himalayan sea salt, I mean, it's just a very complete product.
It's a great product.
And we really, really like it.
And for us, it's tried and true.
Very much so. Yeah, many, many, many years now. Aspartic acid, that's another one that can certainly help. And you can get these supplements too. Methylated folate. So we hear a lot about that. Vitamin D, I was saying that before. I mean, vitamin D it's not even a vitamin. It operates like a hormone in your body.
I'm sorry. I just want to stop you back to the folate and the B vitamins. Yeah. These are vital for healthy embryo development well before the mom knows she's pregnant.
That's a good point. Yes.
So when we're talking about, I want to get pregnant, what should I take? Well, definitely your B vitamins with your folic acid, and it is super important. And you do want to take those together because the folic acid can mask B12, and I believe it's vice versa.
And these need to be methylated.
And I was going to say, and they need to be methylated. So we used to check for those kinds of things. Does a person have problems with methylation?
Check it anymore.
Who cares? Right. Save your shekels, take it methylated, you're good. Yeah,
what you're saying, that seems, so everyone understands. There's a lot of testing that's done out there, and people are often proponents of testing for the MTHFR gene mutation on whether, and this is the gene mutation to see whether or not you actually methylate. You know, I'm never against testing. We're never against it.
No, I mean, it's nice to know.
But
and it's genetically linked.
Right. So if you find out, let's just say you do the test, you spend the money on the test, and you find out you're going to have to take methylated beans. Right. If you come to see me, whether you are or are not MTHFR, having an issue with that or not, I'm still going to give you activated methylated folic acid or any of these B vitamins. Methylated just means it's active. And if you're MTHFR deficient, you can't activate the folate. So it needs to be activated. Either your body has to do it or you have to take it activated. But if you always just take it activated, you don't have to worry.
Correct. Because for people who can activate on their own, they don't have a downside to taking it already methylated.
Correct.
Okay.
So take it methylated and you're covered. Shilajit, I actually love this stuff. I took Shilajit this morning before I came here. This is a really sort of potent fulvic acid among other minerals. And it's just this incredibly dense, mineral-rich black tar. That's to explain it. Very strange, kind of smoky taste to it. Again, we always talk about how Most Americans aren't used to certain tastes, and this is one way to kind of dip your toe into tasting these and just getting familiar with that.
Is there She Legit in my She Legit? Doesn't make you think of
it
that?
is in the Athena
in
herbs.
the How'd you know that's what I was going to say? Or did I actually say
You started to say it.
Oh.
Yeah.
Ooh.
I could tell.
I was stuck on MC Hammer.
Yeah.
Is that who sang that? Anyway, is there? You don't remember.
I'm not remembering.
I posted about that. I love that product. All right, go ahead. Sorry,
IV therapy, sometimes with these B vitamins, other things you just need
and the glutathione.
Yeah. Oh gosh, that's a great point. The glutathione is probably at the top of the list from a fertility standpoint.
Which you can IV and IM.
Yep, either or. And
it's really economical, super effective, great for general health, but does a lot for men and women for this fertility.
Since you're saying that, the protocol for men for fertility and increasing sperm count and motility, etc., is about 2 cc's of glutathione 3 times a week,
which is nothing.
It's not, and it's a finite amount of time. You do it for probably 3 months is what I'd recommend, and that could probably make a big difference because it's a lot of the reason why we would have any level of fertility issues, men or women, at the gonad level, at the testicular level, or the ovarian level, is because of oxidation. And if we can put a very powerful antioxidant like glutathione into the system, then you're going to be able to help with the function of those organs.
Right. When we talk about oxidation, or you hear the concept of oxidation out there, I think you can think about the idea of rust. So you want to, because that's what happens to metal, right? It oxidizes, everybody's seen that. It oxidizes, it turns to rust. So there's a similar concept occurring inside the body. And you want to then take antioxidants. You always make fun of the way I say it. I can't remember how. Anyways, glutathione is fabulous for that. Right?
Absolutely. Love glutathione. Top of the list. Let's talk a little bit about some additional fertility testing. So we talked early on about sperm count. Gentlemen, early on, do yourself a favor, do your partner a favor, and just get it tested so you know what your baseline is. Don't wait. The moment you have made the decision together, go get your baseline. It's a number. It's nice to look at it.
Listen, I just want to say something about that, because just because you know the information and then you do something about it doesn't mean you're going to have like great sperm 2 days later, right? So you really have to work on repairing the quality of your sperm. But the reason I think testing is kind of important anyways, even if there's no fertility problems identified, is because if you know what the quality of your sperm is, then you can have an objective measure for optimizing the quality of the sperm. And there definitely is too much information that reminds us that the baby is going to have its best run at health if the dad's sperm is great condition.
Super sperm. Gonna make some super sperm. Serum inhibin B. This is one of the tests that you probably typically don't see with fertility, but we do recommend this. This is there's an interrelationship between serum inhibin B and ovulatory function for women. It also affects inevitably testicular and sperm production for guys. And so it's a simple test. It's a blood test. For women, you're actually wanting the number higher, and for guys, you're actually wanting it lower. So for guys, if too much of it actually inhibits, or not enough would inhibit. So guys, we want it higher. Women, we want it lower. Again, all this is going to be on Substack if you're looking for that information. Check your iron. We were talking about this before. Iron, back to that whole idea of rusting you, and it oxidizes you. Iron will definitely interfere with testicular function for men and even women, but definitely guys. I really think that the hormone panel, you want to make sure you're checking your prolactin, because prolactin can definitely be one of those secret hormones you didn't realize is there in a high level that could be affecting things.
Right.
Because it's just affecting other hormones and their interplay to be able to achieve pregnancy.
And you had talked about how stress and prolactin are correlated. This picture obviously changes depending excuse me, there's the person who's having a hard time getting pregnant, and then there's the person who's getting pregnant but keeps having miscarriages, like what was in our case. And I remember when I had my, because again, I was in my 40s, I had my ovaries looked at, and the doctor was like, "Oh, there's plenty of follicles in there. You have very young ovaries. You'll keep getting pregnant, but if you aren't doing all of these other things, cervical integrity, calming down the immune system, changing your life so that it doesn't have as much stress and you're not working 70 to 80 hours, you'll keep having miscarriages." So, just want to remind everyone that this is going to be a program that has to be individualized depending on what their particular picture is.
Absolutely. I want to end with this. Testosterone replacement therapy. And this one is a little controversial for guys.
And women.
Okay, yes.
I put them on testosterone.
So let's talk about guys first and why this is controversial. So the testosterone replacement therapy can potentially decrease sperm production. So if you're trying to be as fertile as possible and having the highest number of sperm possible, then you probably wouldn't want to do testosterone replacement. However, if a guy is in a situation where his health is really poor and he wants to start the process of improving his overall health, testosterone can help. Plus, many couples come in and they're just simply not getting busy.
Right.
So that's because, I don't have any libido and I'm wiped out.
Right.
And they get the testosterone and now it's helping with their libido. So
and the quality of the sperm. So there may be a quantity issue, but the quality.
That's a good point too. Yeah, because if you have extremely low testosterone, well, now you're not actually able to, there's a sort of a feedback loop there with the testosterone being able to help with the sperm itself. So it's it's not completely independent. So there is this fine line. And again, it's going to be a little more controversial, but you have to consider what the risks are of it all and realize that maybe testosterone for a short period of time at a low dose might be wise in the overall goal while you're checking your sperm count throughout the process. Because many guys can be on testosterone and we always say, well, that you might have decreased fertility, and they're on testosterone and they get somebody pregnant right away or even after they've been on it for a while. And if you're on testosterone while you're doing other things that are helping with testicular function, such as Clomid and these types of things you would take at the same time as the testosterone, that would decrease that risk.
That's why there's a timeline issue, right? You make decisions based on the timeline. The people that come in to see us and they're like, we want to be pregnant now.
Yeah.
And there's all these things out of whack. Well, we have to kind of discuss what we want to do. But that's why it's so important for men to just be taking care of their general wellness well before they make the decision to get pregnant. Because you can meet someone and instantaneously you're like, I need to have children with you. Yeah. But you weren't taking care of yourself. So do it now. Never wait.
And when it comes to women, for testosterone, so let's say a woman comes in, she says, I want to try to get pregnant. We will definitely give testosterone. In that particular case, it doesn't have any negative effects to the fertility process. But the moment we know that they're pregnant, we would then stop the testosterone therapy.
So I wouldn't use pellets in a female whose primary goal is conception. I would just use injection therapy.
Yeah, because we can stop it. It's out of the system pretty rapidly. Pellets you could put the pellets in her, and then the next day she finds out she's pregnant, and now they have something in her that can last, 3-4 months in her body. But yes, that's very possible. The reason that they say not to be on the testosterone throughout the pregnancy, because they're concerned about hyper levels of testosterone in the fetus, potentially causing future infertility in the fetus.
Right.
Now, I remember when I first learned about that, and it was actually with Dr. Dutera. He got brought up a second time today. And I remember when he said it to me, and I said, oh, that's really interesting. Can you show me some research on that, like the study, so I can understand more? And he said, oh no, there isn't any. So this is one of those, and we've talked about medical dogma many times.
But that was a while ago also. I haven't looked it up in a while.
I haven't looked it up in a little while, but if somebody could share that with us,
that'd be great.
I'd like to see that. But
sorry, I don't mean to take away from the point. The point is
that I highly doubt it, and it's probably more concern about nothing when it comes to that. Another reason is too, because women with PCOS, will often have relatively high-end levels of testosterone. They have actually looked at these women to see whether or not they have they passed on any risks to when they do get pregnant, and they still do when they have PCOS, and there isn't any issue at all.
Yeah.
If anything, we've found that male and female fetuses with high amounts of testosterone from women, they will become more testosterone driven themselves. So we always say that the testosterone male is created by the testosterone female in utero. So just again, putting that out there in terms of a controversy and medical dogma that isn't always founded in reality.
So I'd like to just add one last thing about testosterone and women who are wanting to conceive. Many times the female has very low libido and is not interested in frequency of sex. In addition to that, they tend to be very stressed out. The worst thing you can do when you're trying to get pregnant is add stress to the concept of getting pregnant and not have sex all the time. So the testosterone replacement really goes a long way in helping these women want to be intimate with their partner. And when you're intimate with your partner because you want to, and it's not just because you're like fighting a biological clock, then the chances of conception are exponentially increased. Take out the stress, enjoy each other. Remember why you want to have a baby. Why do you want to have a baby? You want to have a baby together. You want to raise a child together. The most important thing you should do is lovingly have sex all the time.
Let's go make a baby.
Let's go eat.
Are you liking what you're hearing? Do you want to hear more? Do you want others to benefit from all of this great content and all of our funny jokes? Do you want to ask us a question? Please like, subscribe, share, and comment. You can find links to all of our social media channels and all of our featured articles, basically everything that we have, all on our link tree at Longevity Protocol Pod. If you want a little bit more about our personal lives, please be sure to follow us on Instagram at The Sex Docs. Here's where you can comment, ask questions that we directly address in all of our videos. Be sure to subscribe to our Substack. That's where you can get all the information, all the protocols, a lot more detail about this episode that we did today right there on Substack. Finally, if you're ready to make a change in your health and you want to see us as a new patient right here in Scottsdale, Arizona, please inquire through our private practice website, hormone-zone.com.